I'm Mabel Jung. Thanks for watching continuing coverage of the World Healthcare Congress here in Washington, D.C. In our studio now is Alex Jung, who is a partner at Parthenon-EY based out of Chicago. Hi there, Alex. How are you?
Hello, I'm good. Thank you.
Good. And you just led a session here at the Congress. What did it focus on?
I did. I was leading a session on what employers can do to lower their costs, specifically around pharmacy benefits. And we talked a little bit about the kinds of things they should be asking their intermediary partners. Intermediaries being companies like PBMs, some of the pharmacy partners they might be working with, and for those employers that work directly with pharmaceutical manufacturers, the kinds of questions they should be asking to lower their costs.
Right. Well, that certainly is at the top of mind now, drug costs and strategies on how to combat that. What are some of the questions?
I think there's three important ones. So let's take the PBMs for a minute, because there tends to be a lot of hidden costs in the PBM conversation. One of the questions that's important is, what are the rebates they're receiving from the pharmaceutical manufacturers that are being applied towards the reduction of drug prices, and whether employers are getting 100 of those dollars passed through back to them. A second question might be, what other kinds of incentives are you getting beyond rebates that you ought to be passing back on to the plan or to the employees? Another issue employers ought to look at is the formulary design. Is the formulary constructed so that it optimizes rebates, or actually addresses the clinical need of the disease states within that population?
Okay.
And then lastly, employers ought to also be thinking about whether or not there's a way for them to help employees at the pharmacy counter pay for their prescriptions if they can't afford them because of their plan design. One of the things we've talked about is whether or not the rebate can be passed on directly to the employee at the point of sale. A lot of intermediaries are saying that that's possible from an IT perspective, but that plan sponsors don't want to use the dollars that way because they want them to help reduce premiums. The conversation we had today is, however, that some employees have huge affordability issues. And without some form of a subsidy, they may abandon that prescription and not take it at all, and walk away from the pharmacy counter and find themselves with a much more catastrophic situation later on because they didn't have the financial means to pay for it. There are also ways for employers to get more involved with their pharmacy partners to help those situations so that an employee doesn't walk away from the pharmacy counter. There are programs you can put in place with social service agencies like the American Cancer Society or the American Lung Association. Pharmacy companies themselves have foundations to help employers pay for employees that might be hitting at the poverty level. And then PBMs also have foundations that they can use to help subsidize those. We also talk about patient assistance programs that are available by pharmaceutical manufacturers, and some of those have taken kind of a negative turn recently, but that doesn't mean we should abandon them. We should look at ways to make them more equitable and find ways to make those programs available so that people under the $30,000 annual wage limit do not walk away without their prescriptions.
Now, if an employer is not hearing the kinds of answers that they like, what course of action can be taken from there?
So many employers use consultants to help them, and oftentimes they're using consultants based on cost, not quality. And consultants don't always know the right answers because many of them haven't worked inside these organizations. They don't know the mechanics of how things work. They don't know how the economics work. They're not privy to the contracts and the financial terms that are struck between two parties. I would hold your consultant accountable as well. If you have outsourced your benefits administration or you're working with an employee benefit consultant, hold them accountable. Ask them questions about whether or not they really understand how the value chain works, how money changes hands, how the handoffs of the product are actually paid for, what hidden fees exist in the supply chain, and what they're doing to help lower costs beyond just putting the PBM out to bid.
Who's setting the rules for the partnership in the first place?
The employer really has the fiduciary duty. As the plan sponsor, especially if they are self-employed, they are responsible for making sure that all of the parties that they contract with in third-party agreements are holding up their fiduciary duty, even if it's outsourced. So the employer ultimately needs to be well-informed, asking lots of questions, and talking to multiple consultants. Don't just trust the broker or the consultant that you're working with or have been working with for the last 10 to 15 years, because they may be out of touch with how things have changed in the value chain.
And is there a centralized location for information?
I wish there were. Unfortunately, the financial terms between drug companies and PBMs, wholesalers and pharmacies, they're not something that the employer has access to seeing. Those contracts are between two parties that the employer is not a party of. But it doesn't mean that they can't ask questions. As the fiduciary of the trust that is being used to pay for these benefits, and the fact that they are responsible for making sure that their employees are not disadvantaged, they should ask, what are the terms of those agreements? You may not necessarily be able to get the disclosure of all the financial terms, but you should understand the mechanics and whether or not you are being disadvantaged in the process.
Okay, Alex, that's really great guidance. Thank you so much.
Thanks for having me.
And I'm Mabel Jung. Thank you for tuning in.